respected to our respected audience members. As you've just heard, the event is being recorded and it'll be made available on YouTube. Wulan will post it on the chat in the chat box so you can see the URL for the recorded event in case you want to refer friends to it, or if you want to go back and watch a particular session, then it is available. So this is our fourth and final day of the 4-day strategic planning for vector surveillance and control short online course. It's been absolutely great so far. We've had 3 wonderful, instructive, and very enjoyable sessions. I have thoroughly enjoyed it. I think our audience has enjoyed it. Everyone has learned and benefited from it. Only Dr. Pradeep has had to work very hard, for which we are very grateful. Dr. Pradeep Kumar Srivastava, of course, is a previous director of vector-borne disease control in India and many other portfolios that he had, including a responsibility for lymphatic filariasis, various other vector-borne diseases, and also for drafting of strategic planning documents for the various responsibilities in his recent retirement years. He's done consultancies where he's developed strategic plans or reviewed strategic plans of a number of countries. So he comes with a wealth of experience, and he's very able to share that in a simple, easy to digest, and enjoyable way. So we're very fortunate to have Dr. Pradeep share his knowledge in this topic. So may I just ask our audience, please, could you just check? I think do it right now. Just mute yourself. Turn your audio off, please, because it's very distracting if there's conversation or talking in the background. May I also ask if you have questions while Dr. Pradeep is busy with his talk, if you have questions that come to mind, immediately pop them in the Q&A box, because people will populate that Q&A box, and the longer you wait, the lower down on the list you will be, and we're not able to address all the questions at the end of this 2-hour session, in which case, it's better if you put down your question earlier on. So typically the structure is about 1 hour of presentation, a 10-minute comfort break, another roughly 1 hour of presentation, and then we move into the Q&A session. So Dr. Pradeep, and to our technical support team, Dr. Porn in Singapore from Apalma, Dr. Popo Aung here in Bangkok, and also Wulan, Sobiha Aldila Wulandari. Thank you to them for enabling this process to run smoothly. Wulan has just popped something in the chat box there about the certificate of attendance. Please have a look at that. So over to you, Dr. Pradeep. Thank you.
Thank you, Dr. Leo. Thank you very much. And once again, a formal good morning. Today we have a big festival in India. Happy Janmashtami to all. It's the birthday of Lord Krishna today.
Good morning.
Happy Janmashtami to you too, sir, and to everyone.
Is it visible?
Yes, sir.
Yes, it is.
Yes, it is.
Yes, it is. Thank you, Dr.
It is. Thank you, Dr. Pradeep.
Please go ahead.
Okay, all the best. Leo, yesterday, actually, you told last minute your announcement that something we will hear today on mathematics, so I had to include some more slides. So today I'll be going a little fast because that is another very complex subject, but I'll try to solve certain issues and give whatever I know about this program. Today, basic topic is that having understood for the last 3 days about what are the concept of the strategic framework, what is the steps in making the strategic framework, then what are the tools, technology available, what are the different situations we may encounter when we start proceeding from the high malaria burden area to the low malaria burden area, and in between there are so many stations will come, so many stops will come. So where to take a rest, what changes we have to make, how to adopt certain strategy in between, whether there is any innovations required, what are the options available. Now, having understood all those three different topics, three different broad topics rather, now we have come to the point when we have to make, how to make the tailored plan for different situation. So we must understand that what are the things required. And very rightly, when Leo suggested at the end that the calculation, the mathematics behind all these things, that how you arrive, whatever your needs are, that is very important when you put and project in your plan. So I'll try to get that. So these are all today's topic, and that will cover the whole idea. Basically, strategic plan, whatever you are making, you call it as an annual plan, you call it as in your integrated strategic plan, you call it as a national draft or national plan, or state plan or district plan, or your subnational plan. It should have the profile of the, if you are making for the country, it should have a country profile. If you are making for the state, it should have a state profile. You are making for the district, you should have a district profile. Then what is the political context? What is your agreement internationally? First, so it is, everybody knows that this is the commitment is at the highest level, even in Southeast Asia region, even at the global level, from all the ministers, prime ministers, health ministers, chief ministers, everybody has given a green signal, and everybody has given a commitment with the goal to be achieved. Then technical things, when it comes, before technical things, the administrative boundary, the demographic profile of the area, the geography, the socio-economic context, what is the different kinds of groups, what is the total population dynamics, what is the health system in the country it is prevailing, what are the vector-borne disease control program, whether this is one or there are three or four. There are some countries where there are running some 2-3 program, and when NTD was instituted after London Declaration, then what has happened? Many of the countries, they have merged and they have made one department, NTD department. So some of the vector-borne diseases like lymphatic filariasis, like dengue, chikungunya, I mean Aedes-borne diseases, who are declared in the, brought in the group of the NTDs, neglected tropical diseases, they are merged with it. So there is another coordination is required. So you should have these details of this epidemiology of malaria. Coming back to malaria, since you are making a strategic plan for malaria, then you should have epidemiological aspects. What you have for the cross border, and how do you define what is the system you have for the imported malaria case or case characterization and its reporting, its cross notification. Then what are your malaria indicator survey last year? What was the performance basically? Where do you stand actually in last 5 years, or especially for the last year? Last year after 2017, we got 2016 to 2030, the global technical strategy was formulated. So for 16, if it is formulated, we have taken 2015 as a base. So that is how. May I ask all the people to please close down your videos? So then your any external review in between, you have got it done in the program. Usually you do externally evaluation in the mid-year for mid-course correction, and then at the just end of the 1 5-year plan. So the earlier plan, what was after 2016, it was 16 to 22, 17 to 22. Now another 5 years ahead, which we are looking for 23 to 27. And then another 3 years will come where exactly we are and how we will show the sustenance period of 3 years. Then any review of the performance which has been done, previous strategic plan, what has been the outcome, what has been the input versus output, exactly what is our achievement, both in terms of performance, both in terms of achievement, both in terms of inputs and utilization and physical and financial activities. Then any SWOT analysis has been done. That is very, very important. If anybody has done SWOT analysis, what is the strength? And this is basically to do it is not a criticism that everybody must understand and try to advocate after this class whenever you go in your back to your area for implementation or making the strategic plan. It must be emphasized to all the stakeholders that they are for the supportive supervision. So SWOT analysis is not for finding, it is not a fault finding analysis. It's a mission to correct. Then there are collaborative partners, whether there is a mapping, whether you have listed all the collaborative partners, what is their role, responsibilities, all those things. This is basically with these points, when the strategic plan is started making, you start drafting the strategic plan. The first thing should come as it's a vision, goal, then it's mission. Basically vision, you want to have malaria-free country or malaria-free, your goal should be by 2030, aligned with SDG. Your mission should be that every area, all the areas should report this before by 27, and by 2030, whatever you have planned. Then what are the guiding principles for making this plan, making this document? What principle, what are the guiding factors? You have taken epidemiological factor, you have taken demographic, you have taken socio-economic, you have taken different paradigms, different eco-geographical zone, different challenges. What are your strategy for the diagnosis, treatment, case management, referral, reporting, and preventive measures? You have whatever measures you have taken for anti-adult, anti-larval, or the environmental improvement or the infrastructure development, so that the country have a balance. There is nothing stuck up because of our malaria work. Then some assumptions we take that if we do like this, we will reach on this level. We do like this, we will reach on this level. So what assumption we are taking to reach to that area? So we expect that in 1 year we will be reducing to say 20%, then another year we will be reducing another 20%, another year will. So in 5 years we will be reaching to 100%, 2020. This is one sort of assumption. So like that, if anybody is doing some kind of assumption, that should also be reflected in the strategic plan. And then finally, the objective of the plan for implementation. Now take one example, one by one, strategic plan. Objective 1 is, what is the objective? The objective for the action plan is based on the strategy. So what is the objective? Is targeted and focused preventive interventions. Now this is for malaria, but you can't go alone. So it has to be for malaria and other vector-borne diseases, as long as it is a preventive thing. The drugs will be different. So chemotherapy will be different. Treatment will be different. Case management will be different. But as long as you are attacking on the vector mosquito population, you have to stratify the area, that is sub-strategy, updated risk stratification. Earlier you have done some stratification that had changed yesterday, day before yesterday I was showing receptive and non-receptive. Then receptive is divided further, active foci, and then case with receptive with case, receptive without case. So similarly, that stratification will keep on changing. And then implementation of targeted and focused intervention in the different strata. So how are you going to implement which tool in which strata, what infrastructure you have, how are you going to do that? That is very, very important. Similarly, quality assurance, which is another very important for the performance monitoring and having the quality services, delivering the quality services. What is your strategy? Second objective, that is quality assurance, and you have to have a rigorous system you have to establish. If it is not there, you have to put in the plan that previously we did not have, we are lacking, and what will be the activity within this quality assurance. How are you going to do quality check, pre-dispatch, post-dispatch, or even sometimes sample collection in the field to do it within the shelf life of that, either it is drug or it is a diagnostic kits, or it is the insecticides, or any control measures whichever you are taking. So the second one is quality check for the microscopy, whether they are simply examining and just or seeing a negative and positive declaring, or they are actually expert, they are seeing properly whole slides or full thick smear or thin smear, or they are rapid diagnostic kits, whatever they are using, whether they are certified through WHO process or not. So whether they have the full competence to do that. So that kind of quality check and quality assurance has to be ensured, that you have to fix up those activities, and then accordingly you have to fix up the activity, plus it has to be converted into the financial norms. Then you have to sustain the competency. What is your policy for that? If you have given some training for 2 years or 3 years or induction training, and then uh, working training during the period, or spot training, or in the field supervision training, and then suddenly you say you are on the contracts and your services are no more required because of certain other reasons, and we will hire a new one. So again you invest. So that investment which you have done, actually it is gone. So that is how, what is the policy? How are you going to sustain these things should come? This should be one objective in that. Third objective will be, how are you going to strengthen your surveillance, which is the core activity for malaria elimination, surveillance, both epidemiological and entomological. And how are you going to do what is your preparedness for rapid response, epidemic preparedness and rapid response mechanism? How are you going to do that? Those things will have a small sub objective. How are you strengthening your epidemic preparedness? How many people you want at which place, which is the key place, whether you are want to keep at the district level, if your PSCs are within how much kilometers range, or you want to keep at a block level or primary health center level. This is all depending on the planning and then budgeting accordingly. Then how are you going to do the conduct case-based survey? This is another objective, that case-based investigation and its response, that 137 the strategy will come in that. Then how are you going to improve your proactive case detection, and how are you going to improve your rapid response uh, for that? So reactive case detection or proactive case detection, PACD or RACD, that is very, very important for sustaining and achieving the malaria elimination. Any special event, how are you going to maintain? Now in India, there is a G20. So how the health department will see that there is no vector nuisance or there is no mosquito nuisance. So special events, sometimes Commonwealth Games, sometimes Asian Games, sometimes I mean, there are so many events which are organized. So how are you going to, what provision you are keeping, because you don't know that in 5 years what kind of event is going to come. So you have to have some kind of, so that objective also should be clearly spelled out. Then the another objective is, how are we going to strengthen our effective collaboration? Because one department, we have all clearly understood that now it is only health department will not be able to eliminate malaria just by doing our routine survey for surveillance, epidemiological, and then doing the entomological surveillance, and then doing the preventive measures. So in that situation, how are you going to strengthen our collaborations, inviting the stakeholders, bringing them at one platform, and then um, making them to understand that this is your responsibility also, your moral duty also. So how are we going to that? This has got some three sub objectives: partnership and collaboration with field. Or how are we going to do? How many meetings? How what will be the modalities for this? Then how are we going to strengthen our cross border for intercountry collaboration? This is another very important for the finalizing the producing the documentary evidence that entire country, including the border area also, we are free from malaria. So how are we going to strengthen the very important stakeholder is the community. So without community engagement and community participation and community acceptance, there are 3-4 embedded things in the community engagement: their role, their participation, their support, their perception, and then their involvement in delivery and services beyond acceptance. Acceptance is by individually, and then the whole thing has to be changed accordingly. So this is very important. The another objective should be that how we are managing program management, how are we going to improve? And program management is a very complicated things, because when you are doing program management, you must understand that it starts from the administrative policy formulation, guidelines, advisories, calling everybody at one platform, making them accountable continuously, repeatedly. So that is what is program management. And we also should have our own strength very strong. We should not be divided. Like suppose center is doing something and center is advising to the state. So center should not be divided of neither entomologists nor public health experts. If they do not have that competence, states will not have because states are looking always for the central guidance. So state and central guidance are always looking for the collaborative collaboration from the collaborative partners like WHO, APMEN, APLMA, because APLMA says the name itself, it says that Asia Pacific Malaria Leaders Alliance. So this is APMEN is Malaria Elimination Network. So if you don't want to take that network, then it is very difficult for. So technical collaboration at global level, at Southeast Asia, I mean the regional level, then at national level, then at district level, state level, everywhere this collaboration. How are we going to strengthen that? This is very important point. And then how much we are going. If all these things, partners will come together, everybody would like to be sensitive, because this is your baby. The whole malaria elimination concept is baby for the health department. We are seeking the help. We are seeking the collaboration and support from others. So we have to explain them what exactly our need is. And then we can tell that this is your support in this area we require because of your expertise. So we have to strengthen their capacity. Capacity strengthening includes sensitization, advocacy, the mobilization, and then structured training for the people who are actually implementing. So all these things, how are we going to do? How much we are going to invest on that? Or we are bringing some partners, donor partners for that to strengthen. And then how we are going to strengthen our decentralized program. So how are we going to initiate, strengthen, and firm up the bottoms up
Hello, Dr. Pradeep.
Dr. Pradeep, are you with us? I think let's just give Dr. Pradeep a moment. We seem to have lost him there for a moment. You're on mute. You're on mute, Dr. Pradeep. You're still on mute. You're still on mute. That's better.
Somebody changed, so everything gone actually. I'll just share again.
Okay,
Yes.
sorry about that.
It has come?
Yes, there we are, full screen. Thank you for that. Sorry about the disruption. Not sure what happened.
No issue. No issue. So I was telling advocacy intensification is another objective. How are we going to raise the awareness? Then another objective should be operational research. Without the inputs of the applied research, operational research for malaria elimination, though sometimes, I mean, we have to promote for short-term researches and short-term inputs from the operational research, but there may be something which is required for long-term, even beyond 2030. If something happens, we do not know what is going to come. So, but research inputs will go on giving the directions to the program people that look here, there are certain things which are available and it can be helpful for the program implementation, even sustaining the achievements which we have gained beyond beyond 2030 also. And then monitoring and evaluation at each level, performance, supervision, implementation, and then even during certification of malaria elimination, whenever the team comes and team visits, nothing to hide, but nothing to exaggerate also. So everything should be very, very clear, and these are all the parts of monitoring and evaluation. And then the document should have different annexures, different references, where from we are quoting, it is being quoted from some research, some publications, some documents, because during the 5 years or previous 5 years, many publications from the national scientists, from the national researchers, from the national level or state level implementers, it might have been documented in different literature, so that also should be referenced properly. This framework, when we come finally for the vector surveillance and vector control, I just gave one example quickly to run through that. Entire vector control operations are governed under the framework of integrated vector management. As I told you the first slide, that it is when we come to talk to preventive measures, it will not be in isolation for malaria alone. It will be for malaria and other vector-borne diseases prevailing in that area. And that is how the whole situation of IVM comes as a concept, that you have to do the situation analysis, which area you are going to stratify based on the epidemiological things, based on the vector assessment, based on the local determinants, and then you do stratification. Then you select the vector control tools. Then you work out for your need and resources. That is what this topic is being taken. And then you finally implement as per the strategy guidelines, monitor it. So these are 5 components. What exactly you require is the knowledge about the local vector abundance, breeding sites, you are mapping the things where it is located, then what is the seasonal transition pattern, and then resting, and then feeding, insecticide. Yesterday we have discussed a lot on this. Then all those 5 parameters, they are giving some kinds of impact, some kinds of purpose it has got. So advocacy social, it actually promotes IVM policy, community empowerment, and action against the offenses. Because legislation is also embedded a part, because when you are doing education, you have to tell them, look here, we are educating that mosquitoes should not be allowed to breed in your campus or in your peri-domestic area. But if you deliberately do it, you are liable to be penalized. Intersectoral collaboration brings all these partners together. Integrated approach for this, it gives you a chance to integrate different vector control tools for different diseases at one point of time. So that the one example is that you cannot go for larviciding separately today for malaria and tomorrow for dengue. You cannot do insect indoor residual spray for malaria today and go for targeted IRS for 1.5 meters below for dengue separately. No. So whatever you are doing, you have to plan and integrate. So those things should be embedded in that. Evidence-based decision making, this requires a little bit more discussion. I'll come back to that, because you have to generate the evidence and you have to classify and you have to take a decision on that. How are you going to do, especially for the vector control? I'll talk to that. Then capacity building, how you are investing. What you have the opportunity, you must avail it. You have got some centers at WHO, you have got some collaborative centers, you have
கஷ்டமா இருக்கு எனக்கு அதிகமா ரொம்ப மோசம்
Shanti. Please mute. Okay, thank you. So, sorry. So, oh. So the last one was the capacity building, how we should map our opportunity, where in the state also we may be having some resource centers, some training centers. So the infrastructure, the capacity, the resource people, the mapping of those things should be done. And then people with the finance which are coming forward, yes, they are always welcome. So we should avail this opportunity so that our capacity building, but there should not be any compromise on the structuring the training programs. Now, this also IVM component, that one side, if you see one side, there are source reduction, minor if you start from the larval source reduction. These are all the things which are taken as an inputs. Then in the larvae siding, you have got options for the oiling, PMFOS, biolarvicide, and insect growth regulator. Then you have got right side, second one, the anti-adults, you have got LLIN, you have got IRS, you have targeted IRS, fogging, ULV. You have got certain innovations also, which also some of the countries, because it is for the 20 countries or more. So you should have some innovative approaches, which if you are able to accommodate them within the governance and within the framework of your country rules and regulations. So what are the innovations? There are genetically modified mosquitoes, that is and then sterile insect techniques and the attractive toxic sugar baits. So these are certain innovative approaches, which by and large it has not come to the program, but they are available as an innovative measures. And if somebody wants, they can just do that. Then these two things are go simultaneously: advocacy with the community, as I have told.
ஆஞ்சநேயருக்கும் விநாயகர் கோயிலுக்கும் போக
So then to have all these things, the previous graph, you should have everybody together working. If you see, look here, if you want to see this impact and you want to implement this controlling activity under IVM, so then your governance, it should start, because governance is very, very important. Without governance, you just can't work. So the monitoring, guidance to the states, to the districts, to the blocks, subnational level, and the corporate and municipal corporation and municipality urban areas. And then there are stakeholders. I have just listed few stakeholders, but look, the complicated bridge. If you feel that, then only all these people working together, you will be achieving impact, good impact with everybody's inputs. If you see this bridge is broken, you are not getting the feedback from the rail department. If this bridge is broken, you are not getting from the environment ministry or agriculture ministry. So the bridge is so much complicated that you have to, your role is to keep the whole bridge intact, and that is what is intersectoral collaboration. Now I was talking about the fourth one, the evidence-based generation. Look here, we are talking of malaria. If malaria has been reduced, I'm just giving an example for India. If malaria has been reduced, see the red color, it has been reduced in last 5 years to this level. So your decision also should not be what you have been doing, implementing things here. It should not be implementing here. This is very, very important. Similarly, if you take in this particular area, dengue was less in 2011, but now see 2022, the whole country is under the influence of the dengue. So your decision, not only this is epidemiological stratification, case-based. But when you come back, seeing the vector control measures, we know that for dengue, chikungunya, and urban malaria, STFNSI, larval source management is the primary thing. Where Aedes influences, it is targeted IRS, though it is piloting. It is being done in some countries only, and lethal ovitraps. But malaria high burden area, LLI and IRS. Yesterday we have seen. But what is actually required is when you are making a strategic plan, when you are giving that, how are you going to decide what will be your decision-making process for integrated vector management and vector control? You should have 5 steps. And this should be very clearly spelled out in the strategic plan document so that this is your actually whole plan for prevention. It should be, you should select the disease, you should have identify the vectors, then you should determine the possible vector control methods. Out of that, you should select. While selecting the tools, you should have the in consideration mind, cost, efficacy, politics, logistics, safety, pesticides, and environmental criteria you must take into consideration, and then only your delivery and synergy will be there. Just see the example. This is one chart which please see very click. I'll just minimize this. So please see this. If suppose these so many vectors are there, so these are the steps: 1, targeted VBD, then vector selection, possible method selection, and then finally you are concising. How? You come back. I'll show you first with the blank graphs, and then I'll come back you the pictorial graph. You have got 3 plus 4, 7 vector-borne diseases prevalent in your area, and 3 you have targeted for taking this. Now the second step will be, out of these 3 diseases, you are seeing which is the vectors for this. Say, for example, this is malaria or LF or visceral leishmaniasis or anything. So you are taking, there are 2 vectors, there are 3 vectors, there is 1 single vector. So once you have identified these vectors, then you see what are the possible methods to control these vectors, whether it is LLIN, IRS, or larvicide, or environmental measures, or source reduction, or again IRS. So there will be some doubling, some duplication. Out of this, which one is getting more common and giving more impact on many diseases? Then you go for the next step. Before going to the next step, you see your own entomological intelligence based on the documentary evidence. You see which implementation activities is more effective against Anopheles, Culex, Aedes, Mansonia, and Phlebotomus. By and large, we are working on this. So if you see Anopheles, I'll just give one example. ITN is a very good effective. IRS is also effective. Space spraying is partially, because every time you are not doing it, is only for the outbreak containment. And then prevention of breeding in field, yes, it is also effective. Similarly for Culex, similarly for Aedes. So having gone through this chart, you take a decision. Next step will come here, that out of these 3, whatever overlapping or superimposing, you are selecting this, because this is one which is 1, 2, it is coming. Now yellow one is, see the diets, it is coming. And then red one is only restricted, only you are taking 1. So whichever is common, you are taking selection. Then based on this, you have to see A, B, C. Now, if you see the 5 things which I told you, 6 things: cost, efficacy, policy, legislative, whether your policy allows this ITN, whether ITN are efficacious, whether it is cost effective, logistically, whether you are able to supply, what is your safety measure, and whether it is not creating any hazard to environment. So you take, for example, ITN is going everywhere, it is plus. IRS cost maybe little more than LLIN, because this is purchased for 3 years and this is every year 2 rounds or 3 rounds with additional rounds you have to do it. But rest of the things, okay. Some are showing only plus, some are not effective, not environment friendly. Prevention of breeding sites also for policy and logistics in rural countries, agriculture main countries, you cannot have policy for larval prevention of breeding sites by the health department everywhere, because there are many stakeholders involved, and the logistics is huge. Logistics is requirement. So seeing this chart again, you take a decision, give them the weightage. What is cost, political, policy, logistics, efficacy, and possible methods. If malaria you want to take ITN, yes, it is all plus. It is cost effective, it is policy is there, it is logistically supplyable, it is efficacy. So you get 4 points. IRS policy is, yes, right from beginning it is there, and efficacy, it is very efficacious, but Cost effective, yes, it fails. And then logistics comparatively, it is little more difficult. So it gets again but 4 points. So similarly, you take for larvicide. And another disease, if you take prevailing in that area, ITN gets 4 points, larvicide gets 3 points, and environment gets 1 point. So what is finally, you add together, ITN gets 8 points, IRS get 4 points, larvicide gets 5 points, environment gets. So the recommended preference of the tools becomes first ITN, second larvicide, third IRS, fourth goes to environment. If you see in the pictorial diagram of this, finally, when you are going for this delivery package, you are selecting those. But when you see the real example, malaria, dengue, chikungunya, Zika, J, LF, and visceral leishmaniasis. See, visceral leishmaniasis, you are taking phlebotomus, so you are giving only IRS. See the color, green color. LF, you are taking Culex transmitted, Aedes transmitted, Mansonia transmitted. Culex transmitted, you have got LLI and LSM because IRS will not be there. Aedes, you are LSM and space spray. Malaria, Mansonia transmitted only environment. But Aedes, for that Aedes aegypti and albopictus, you have got LSM, you have got LSM, you have got LLIN. So, and then malaria in urban areas, you have got all LLIN, LSM, and then environmental also for Stephen's eye. Rural areas, you have got all the three LLIN, IRS, LSM. So if you just look at this LLIN, LSM, and IRS, and see. Now, how many colors which you are seeing more in that? So if you see this violet color, it is effective against Anopheline, Aedes, and Culex. LSM is effective against Anopheline, Aedes, and Culex. IRS is effective against Anopheline and phlebotomus, that is sandfly, that is visceral leishmaniasis. And SS is only for outbreak. So again, here also you see 1, 2, 3. That way it comes the priority. That is how your decision-making process goes on. That is how once you have taken a decision, then your next thing comes in the strategic plan framing, tailoring. When in this area, which activity will be done? Source reduction, management, water drains, LLIN, ITN, or irrigation management. When it will be done throughout the year, where it will be done in the residential area or high risk area or endemic area, targeted vector, all the three, but here with LLIN only Anopheline and Culex, Anopheline JE vectors. Then targeted intervention for part of residential area, waste plant management, 80% of the houses should be covered. LLIN, it is an absolute coverage. So like this chart you have to see to select the appropriate vector control methods. You have got another thing which you have to show, that if different departments are also doing or involving something, we have learned during COVID time that sanitization was giving. But in sanitization, what kind of synchronization? Many of the time you go and people, they will say that we don't have the pumps or the pumps are faulty. But you know that there are other departments. So sanitization, if you see this left side, you see during the sanitization, they were using knapsack sprayer for sanitization. You are also doing for anti-larval spray. They were using sometimes fogging machine, they were converted for the aerial spray with the sanitization. Technically, it is right or wrong. I don't want to discuss that. But there is a scope of taking this help here. So that is why synchronization, this particular portion, you can use it, you can call them, you can take their help. The same thing is told under the One Health umbrella also, that One Health umbrella keeps all the things together. Environment should be good, human should be free of all the diseases, animal should also be taken into care, and vectors and vector-borne diseases should be managed properly. So this is again, you get human, vectors, environment, and animal all together comes within the animal health. So you cannot say that because of this particular program, our program is applying. That era is gone of verticality. Now you see, when you are planning, this is one example I am giving from our own experiences. You forget about the zones or you forget about the districts. You can have, when you are fixing the sentinel sites, this is another example when you are making a roadmap. How are you going for 1 year, second year, third year in the strategic plan? You can select some PSC. If you are covering by fixing some sites which is representative for 2 districts with the same staff, So you can select, if you are selecting 2 districts, you can select 2 PSCs in each district, and you can do regular visits in all the months. But if your area represents 3 districts, cover 3 districts, you can select most problematic district, 2 PSC, and do the regular visits. You cannot do that. Each of the other 2 districts, one district you select 2 PSC, other districts you select one districts, 2 different PSC, and visit alternate months. If your area is representing your sentinel sites and spot check sites, representing 4 districts, then what you should do, you should take up the entomological survey, first and second districts in January, March, alternate month. January, you have left February, then March, then April, May, leave May, then June leave, then July, like that. And then third and fourth district. This is just an indicative planning which we have been following in our country, many of the places. So similarly for 5 districts area, or the more vulnerable, more wider area, if you are having 6 districts, if you are not able, you have got some resource crunch, you are covering for 6 districts with 1 sentinel sites. I remember when I was making the insecticide resistance management plan for Bhutan, there were 5-6 districts. When we started telling that, okay, when 1 district we will fix up some sentinel site, then the suggestion came from the program during mutual discussion only. It is of the line that we have got a strength at the central level and it is very nearby. So we will cover, we will send the team accordingly. So we have to make our own calendar of activity according to the feasible resources. We should have in the plan, we should have a different kinds of technical committee, which will from time to time, they will review the things, and we should have an integrated vector-borne disease committee, a technical committee. This should be only technical, purely technical people. It should be headed by Director General of Health Services or whosoever is heading the country, who is the technical head for the vector-borne disease control program, with the head of the malaria department, with the head of other vector-borne diseases. If you are having NTD department, so all the departments should come here as a party. Then representative from WHO. I have just put red mark because some of the country, it is not mandatory. It all depends on the country chief, how long they want to take on board the external agency for their internal meeting, or it is at their wish that they want to take them regularly or they want to take their advice separately. That is up to them. Then different departments, environment, health promotion, education, urban, agriculture, so on and so forth. There is a long list. So a list may be expanded. So this is one thing which it should be in the plan document, it should come. Now, when you are converting your physical activity to the financial activity in the plan document, when you are tailoring your drafting your document specific to the area, you must have that what is the quantity you require actually. So now please look very carefully again that LLIN norms. What should be the LLIN norms? LLIN norms, normally our target is less than 1 API at first go. So in a population of 1,000, annually there should be less than 1 case. It means 1 case cannot be divided into 2 or 3. So what is happening? What is happening? 1 case may come in January, February, March, April, May, June. 1 case cannot come half in this month and half in that month. Or the same case may be repeated because of some other reasons, technical reasons. So, but the case, if there is only 1 case which is counted 1 person, so it will come only in 1. So in 12 months, if only 1 case is coming in any of the month, this is your target first go. Then it should be without indigenous transmission, it should be classified. Prior to that, how much people should be protected? What should be LLIN? We take the example of LLIN. So what should be the norm? The norm is that assumptions are, now see, the norm is for the procurement purposes. When you are making a logistic arrangement, you can't collect everybody, okay, for this particular area, we will give this much for this size, this much for this size, this much. So what you take, you generalize, you streamline the process for making it more simpler during the procurement process. So the basic norm for this procurement process is divide the population by the factor of 1.8, means 1 bed need for 1.8%. It may cover because you are giving different sizes. I'm coming to that. So the assumption are the districts with API more than 5, all the subcenters should have. Districts with API between 2 to 5, at least 50% population should be protected. They will be having more than one API. Districts between 1 to 2, also some districts will have more than one API, some sub-centers. Then district between 0 to 1, they will also have some centers, 50% or 10% or 25%. So here the assumption is that first category 50% sub-center, then 25%, then 1%. So these many sub-centers, just assumption. Some assumption you have to calculate, and then you have to go for, it may be different from different countries. And then you have to keep a 3 years provision, because these manufacturers, they have given shelf life of the LLIN or the ITN is 3 years. So when you procure that with the norms, suppose there is you require 18 million bed nets, 18 million airlines. And when you are distributing, you have got 3 sizes, because if there are people at different, their need is for different sizes. So there is single size, there is a queen size that is 5 by 6.5, and then there is a king bed size 6 by 6 and 6 by 6 or 6.5 by 6.5. So according to the demography, now see how important the demographic profile which you have given in the first instance in the strategic plan. Based on the demographic profile, what is the population dynamics in that area, that how many, what is the percentage of the population in this particular area of this group, and this group. So on an average of 100%, if you divide, the maximum 77-78% goes to the queen size, where 2 people can sleep, one mother or one baby or a small baby or 2 small children. Single size is one very less amount, because many of the people, they would like to sleep either with the children. And then there is a double bed size, full-fledged, that is roughly around 15%. So this is the tentative requirement norms which we have worked out during our logistic and supply chain management distribution. You take the example of IRS. IRS is another intervention, and this is little more complicated to work out the quantity of the insecticide. If you have got synthetic pyrethroid, you want 2 rounds per year. If there is a perennial transmission or more than 5 months, you require additional rounds at the fag end of the year. That all depends on your transmission intensity. Whatever you work it out, you should have the 10% or 20% buffer, whatever provision it is. That will help you in covering any gap or any delay in the procurement for the next cycle it comes. And then you should upload the transportation cost and everything. Now, how to calculate the requirement? This is another, now as per the Leo's yesterday's suggestions, I have just added these slides. If you see, for example, again the assumption that 3 meter wide and 3 meter length of the house and 3 meter height. So one wall is 3 meter by 3 meter, basically 9 square meter. And there should be 4 walls, both the sides. So there will be 36 square meter area. And then there will be one ceiling for the spraying, that is again 3 by 3, so 9. If the length is more, width is less, you can calculate later on accordingly. So then total area becomes 45 square meter. Now, if take 4 rooms like this in a house, if you take 4 rooms like this, so the total and plus kitchen you take little bit. So instead of the total 4 rooms area becomes 45 into 480 square meter. And the washroom area, if you take kitchen and washroom, half of that, so 20 square meter. So total becomes 200 square meter for one house. This is one tentative calculation. So further go down, the exact area, the number of houses in a village, 200 meter square you have calculated for one house on an average. This 200 meter square, please remember, I have just marked here red. So number of houses in a village, if it is say 5,000. 5,000 houses in a village, one house will have 200 meter square. And insecticide, suppose you have selected as a lambda cyhalothrin, that is 25 milligram per meter square dose. So the formulation is 10%. that water dispersible powder when it comes. Please, I will request to switch off your video. So then, and your cycle is two times. I mean, 2 months. You want to keep the spray period, spraying for 2 months, and in each month there is a 20 working days. So you are not taking on Saturday, Sunday. So 40 working days. Now with these 3-4 basic components, if you want to work it out, treatment cycle per year is 2 times. Average output of one pump, how much it comes? It comes to 10 houses, means if a one spray worker covers 10 houses, these are all calculation purposes. I'm just giving one example. You can see in the field and you can change these numbers. So 200 meter square, how many times it will take? It will cover these 10 houses. It will have, if one spray worker covers 10 houses of 200 meter square, the spray worker will be able to cover 2000 meter square. These are all simple mathematics. An insecticide formulation which is required for this is important. Then your technical insecticide per house, you want 25 milligram for one square meter. So for one square meter, you require 25 milligrams. So for 200 meter square means for one house, you require 5,000 milligrams. So for 5,000 milligram, what should be the 10% of water dispersible powder? So because you have worked out for the active ingredient, it is only 10%. So for 100%, if it will be, you require actually 50,000 milligram or 50 gram of the formulation. If you require 50,000 of gram of 50 gram, then insecticide formulation required for the area. Other way around, if you do per cycle, it is 5,000 houses into 50 gram, then it becomes 250,000 gram. Just multiply that. 250,000 gram means 250 kg. So total insecticide required for 2 cycle is for 1 year is 250 into 2. So that is 500 kg. So if you are using lambda cyhalothrin with 25 milligram per square meter dose for one village containing 5,000 houses, you require 250, 500 kg for 2 rounds. Keep the reserve at least 50 kg. So your total requirement becomes 550 kg. And this you will be, the area will be covering 5,000 houses, or total if you multiply by 200 meter square for one house, you will be covering 1,000 square meter. I'll be available for any clarification later on also with my email and my phone number, because I have to go a little fast for the time management. I know that this is a little more complex subject. Then spray workers you would like to have, because all these things you have to factor in your strategic plan, how much quantity you require, not just by seeing the last year and copy and paste. So you have to work it out, and then only this is known as meticulous planning. Then if you, how much squared spray workers you require. So for 5,000 houses, if you want to cover, which is 200 square meter area, so you are actually covering this much surface area, 1 million meter square area. And one area, which is one spray worker covers 2,000 square meter. And for 40 days, if the cycle you have taken for 40 days, many of the videos are on. I'm sorry to say, many of the videos are on, which is actually
May we ask if our audience members, can you turn your audio off and your video off as well, please? It's distracting for the speaker.
yes,
Please
because somebody is taking tea, somebody is changing the dress.
yeah, please. Please, could you turn your video off? Thank you.
No problem. Thank you, Leo. Thank you. So if the spray worker is covering 2,000 square meter and he is engaged for 40 days, so actually in one day 2,000 square meter area is covering. So 40 days he will be able to cover 80,000 square meter. Whereas your target is to cover this much square meter. So if you divide this 1,000 square meter by one person's coverage for 40 days, it comes around 12.5 days or 13 persons are the total requirement is 13 persons, number of spray workers. Now, other way around, if you see, This is one side of calculation. The other type of calculation is number of houses covered per spray worker per day is 10. Simple. So 40 days he will be covering 400 houses. 40 days is total you are engaging in. So he'll be able to cover 400 houses. Your target is 5,000 houses in the village. So 5,000 divided by 400, it comes 12.5. Round it also comes same, 13 and 13. So it is almost same. Whether this way you calculate by number of houses to be covered by one spray worker or number of total area to be covered, it comes the same. Now, there is a general rule for working out this calculation because it will be very difficult for cover every village every year that how much area you want or how much area you want to cover, or if you don't like. So on tentatively, DDT started first time. So DDT was the first insecticide to be used for IRS. So we have taken DDT as a base. And DDT has been worked out that you require to cover 1 million population, that is 100,000 population, 150 metric ton DDT 50% is required for 2 rounds. If the dose is 1 gram per meter square, you change the dose 2 gram, the calculation will change, the requirement will change. So take this as a standard that 150 metric ton for 1 million population 2 rounds. So for same population, 1 million population, what will be requirement for other class, that is malathion? Malathion is supplied in 25% water dispersible powder. This formula is by more or less, more by less. So whatever is required, you had 150 metric ton for DDT standard. You got DDT 50%, but you have got now 25% malathion here. You have got 2 rounds of DDT, but for malathion, you have to spray 3 rounds because the residual toxicity is, residual efficacy is 6 weeks. So the 3 will come on the top. So more by less, 3 by 2. And then malathion, you require 2 gram per square meter, where a DDT you require 1 gram per square meter. So 1000 milligram or 2000 milligram. You solve this, this comes a 900 metric ton for 3 rounds. So 300 metric ton per round. Similarly, if you take another example, deltamethrin, which is synthetic quattro at 2.5%, that is the recommended. Deltamethrin 20 milligram per square meter dose, 2 rounds and 2.5% formulation is supplied to you. Now you have DDT, same standard, 150 metric ton. You had 50% DDT. You had 2 rounds of DDT. But here you have got 2.5% solution instead of 50% water dispersible powder. You have got 2.5% WD. You have got here also 2 rounds, so same. But here you have got 20 milligram. Here you have got 1000 milligrams. So you divide it, it becomes 60 metric ton. Similarly, here also, if you see, for lambda xylithin alpha, same calculation, the 5% amount, it comes 18.7%, 10%, and then 5% formulation, it comes 37.5%. Why it is not exactly being divided by 4 for 2.5%? Because the dose is different. That was 20 milligram and this is 25 milligram. So the factor of 3.2 is applicable here. Sorry. Now you see how much pumps you require and how much. Now there is something very important. There are now 2 kinds of pump which is being used. One with CFE, one without CFE. Control flow valve I showed you yesterday. So without control flow valve, the tank pressure is always 40 pounds and swath width is 75 centimeter. This is standard 75 and 5. Effective swath is actually 70 centimeter. If nozzle flat fan is 8002, yesterday I explained that 80-degree angle for swath and 2 ounces for this, 2 gallons, 0.2 gallons. Now take another example. If the room size is 6 meter long, 3 meter wide or 3 meter height. So what will happen? The area coverage per minute is the discharge rate 700 divided by 40 psi pressure. So this becomes 17.5 square meter. So wall height is 3 meter and length is 6 meter. So total is 18 square meter. So if 18 square meter, so total area you have to cover with the spray and your effective swath is only 0.70 meter. So you multiply by, it becomes 2.1 square meter, because you are going like this, you are coming back like this. So if you multiply 0.7 meter width and 3 meter height, so the total area in one swath, one side movement, you are covering 2.1 square meter. You have to cover 18 square meter. So the whole area, one swath will cover 2.1 square meter. So roughly around, you divide by 18 by 2.1 means 2. So around about it requires 9 times movement here. And this 9 time movement, time per swath is 60 seconds. 1 minute you are covering. So 9 swaths you are taking, 6.6 seconds for one swath. That is what we say counting. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. That is what we usually do it. This is what is 9 movements. One, this, and this is 3 meter height, and this is, so this total area becomes one stretch, one area, then second, then third, then fourth, then so 9 times if you move, you will be able to cover this area. Another calculation for the dose. This is again important calculation. That dose is always calculated. Flow rate of the pump, either it is a high strap pump or hand compression. Spray operator should spray. If suppose he is spraying 6 feet high wall or 3 meters height wall with a 0.75 swath. So the speed should be, see, 24 meter per minute. It's coming like that. So what will be the spray deposit rate? Spray deposit rate is what is volume is coming in ml per minute. That is your discharge rate. Then what is your swath into operator speed, your movement. So whatever swath is coming, I mean whatever area you are covering, whatever speed you are coming, so this much multiplied, and then what is volume is coming. So in that your spray will be calculated, that how much per minute it is giving the dividend, what is the output is coming. Example you take, spray, suppose volume of suspension in ml, swath. So suppose there is a 550 ml volume of suspension, and then 0.75 is the swath, and 0.24 is the speed, 24 meter per minute. So what happens? It comes around 30 milliliter per meter square. So your spray deposit rate will be 1 meter square, 30 ml will be utilized. But if you are taking for the other pumps, where it will come little more, 40 milliliter per square meter it will come. Now, you see the example. If you take the discharge rate, discharge rate means deposit rate, sorry, 40 milliliter per square meter. So if discharge rate is 700 ml, so what will happen per minute? 700 divided by this spray deposit rate, so it will cover 17.5 square meter. It will cover 17. If it is 680 discharge rate, nozzle discharge rate, it will be 17. If it is 750 ml discharge rate, it will be 18.6 with the deposit rate of 40 cent. And if it is 780, it will be 19.5 square meter. So all these different discharge rates, it will come. But in program, we take the average. The stirrup pump, which was traditionally being used since long, there the nozzle was different. So the swath was less. Swath was only 53 centimeter. And then, so this 53 centimeter, that was the swath. So you have to go more number of rounds, or it will take little more time. It will take little more time. So you have to adjust it, because most of the time it was manually operated. Same calculation will come if the discharge, this is spray deposit rate. If the deposit rate is 40 ml per square meter, same calculation will come, but the time will be a little more, 1 minute. What is the spray technique? Basically, this is made for the stirrup pump, which many of the countries are not using. But in India, many of the places is still being used. It is 18 inches, 740 to 850 average discharge rate of the nozzle. And you have to make 20 to 26 strokes with the plunger movement. this will create 40-pound pressure and 10-pound pressure it will create there on the nozzle when you are putting the spray lens directly on. And this will give 650 to 750 ml per minute. That is what is usually checked up. And this takes 5 minutes to spray one house. So this is all the calculation based. You see, this is ready reckoner chart for all those things. Nozzle pressure at tanks, strokes, discharge rate, sweat size, overlapping area. So see many stirrup pump. This is basically 60 degree, 10-pound pressure only at this nozzle, but it's hand compression pump without control flow valve. It is 80-degree angle and 8001 nozzle. There is 40-pound pressure in the tank, 10-pound pressure there on the lens, the nozzle. But when you are using control flow valve, which usually you call it as a hand compressor or the Hudson pump or some other brand name pump. Then what happens when you, this is 8002 nozzle, yesterday I told, there is a 58-pound pressure is created inside the tank. And when control flow valve there, one stroke will have 1 psi, so 58 times count it will be creating. But there is a meter is given, and that will tell you 58-pound pressure. So we are normally using a red color CFV, which is 1.5 bar, which gives 550 ml per minute spray deposit rate. So swath size is here 53 centimeter, but in both the hand compression pump it is 75. 5 centimeter overlapping area is common. Average area of house here it covers 150, but they cover 200 square meter because their swath is very regular and very consistent. The swath 3 meter height, they take 1.44. Here they cover 2.10, and here also they cover 2.10 square meter. Number of swaths, here you require 13, 12 or 13 swaths, but here you require only 9 rounds of swath. Then area covered, here again you cover in 5 minutes, you cover per house. Here you cover 20 square meter per minute, 200 houses. If you do the back calculation also with the discharge rate, it will come the same almost 37 meter square, whatever I have told. So we need not to deliberate on this. I know that this is more complex, but the important is that one swath will require only 1.5 seconds, usually 1 second, 1.5 seconds. But you have to observe practically in the field that whether one swath is covered in 1 second or 2 seconds or not. It is usually take 5 seconds or 6 seconds. Now, the another important point which many of the people yesterday or day before yesterday, some people they were asking. This was a standard formula long back, and our predecessors, they were very, very intelligent. You see, the formula they gave for DDT 234, very easy to remember. Initially, 75% DDT was being supplied. So 234 means 2 pounds in 3 gallons of water for 4 houses. And 4 houses means 156,000 square feet. Now you convert into new metric system. The 2 pounds roughly it comes 660 grams. 3 gallons roughly comes around 10 liters. 4 houses, 6,000 feet comes around 500 square meter. That is what is nowadays the guideline says, whether it is a WHO, whether it is a national guidelines, it says the same thing, that 500 square meter cover area, you put 10 liters of water. And you put 1 kg, 10 liters of water, you cover 500. 1 kg means you have to, the 3 pounds, 50% DDT, it requires 3 pounds, so that is roughly around 1 kg. So this is what is given in the guidelines. Malathion, same thing, you convert into that, it was 632, 2 kg, 10 liters, 250 square meter it will cover. So the only thing problem Malathion you have to do twice because it is the dose is heavy, so you have to make single half dose and then half dose so that you cover twice. Coming to the larvicidal calculations mathematics. Leo, I'm sorry, I was just continuing. Is there any time for break now? 11:40 or maybe little more we continue then.
I think it's about, I think people would appreciate a short break, Dr. Pradeep.
Okay. I'm sorry. I just went in that same flow.
No. I know you have a lot of slides, so I didn't want to interrupt you.
Okay, okay.
Are we about halfway through the slides,
Yes,
Dr. Pradeep?
yes,
Yeah.
yes,
All right.
yes.
Let's take a 10-minute break. Thank you, everyone.
We were here. Yes. So for larvicidal, we are using knapsack sprayers, and the rate of application is always that is how much area will be covered with how much. So how much liquid is being sprayed per meter square, and this rate of application milliliter per meter square is worked out. What is the flow rate? Flow rate is output milliliter in per minute. And then what is the swath, total width of the swath, and walking speed. These are all common for all. So if you are moving in one direction, your speed with the swath which you are actually spraying the area, and what is your flow rate. If you divide that, you will get per meter square in 1 square meter, what is your ml you are just actually utilizing, and that is what the application rate. So for example, if flow rate is 1000 milliliter, which is usually there in the hand compression pump per minute, your width of the swath is 1 meter, and then your walking speed is 50. Actually, when we always say that you count your step 1, 2, 3, 4. But by and large, your all footsteps are not exactly uniformly 1 meter. So in 60 seconds, you don't cover 60 steps or 60 meters. On an average, you cover only 50 meters. That is why 50 meters per minute it is taken 60 seconds. Then rate of application will be 1000, that is flow rate, divided by 1 meter swath into 50 meters you are walking in 60 seconds. So 1 minute. So that this works out to be 20 milliliter per meter square. Now, the concentration percentage, how do you work out? How we calculate the concentration of the strength of the solution or suspension? Oh my God, many people, they start video on and go on off. So when they are doing concentration percentage, they are calculating the dose to be applied, whatever dose is recommended. Whatever dose is recommended. And then what is your application rate, which you have worked out here. And then you multiply by 100, it comes the concentration. And if you multiply by 100, it comes the percentage. For example, if dose is 0.5 gram per meter square, so you write 0.5 here. You have worked out 20 ml per meter square, that is your application rate. And then multiply by 100, it becomes 2.5%. So your solution is actually, when you are making ready to use suspension, it becomes 2.5%. Now, see the another example, larviciding, when you are practically doing, your breeding places is small or narrow, maybe 1 to 3 meters wide. So 1 meter wide, if it is there, you can cover with knapsack sprayer. And the length is 1 meter with 120-degree gooseneck and cone or 8002 flat fan nozzle. If the area is to be covered, you can use flat fan. Otherwise, normally you use cone gooseneck, cone nozzles. Coverage speed, again the same thing, 1 square meter per second. That means 1 meter you are walking and 1 meter you are covering with the soil. So 1 square meter in 1 step. So 1 second. For wider area, you have to go and then come back, or you have to use another kind of swath or lance. So usually what we cover, will cover 6 to 10 square meters per second in a wider area, because your spray side you are covering double. In 60 seconds, coverage will be somewhere 360 to 600 square meter. And suppose there is a 1 hectare, if you want to cover, that is 10,000 square meter or 1 hectare, it will require then 20 to 30 minutes. On an average, from 17 to 28, it works out, but on an average, it will require 20 to 30 minutes. So this is very important for the calculation purposes whenever you are walking. This is a standard chart for Indian scenario, which we have given as for all the larvicides, MLO, Temifos, BTI, Russian strain, and one indigenous strain, different formulation, water dispersible powder, wettable powder or aqueous suspension. Then we have also given for insect growth regulator, diflubenzuran, that is comes in the wettable powder formulation, and then pyriproxyfen, that is comes in the granular formulation. Ready to use suspension also we have given that how you will make the suspension 200 liter or 100 liter, whatever it is, and you are using it. You are using it per square meter, per linear meter, or per hectare. How much you are using and how you are using. Now, to have to there was some confusion among some people's mind. Let me show the another chart which is there. This chart will clarify everything. You see, if Temifos 50% EC, we say that 2.5 ml you take. 2.5 ml means actually 1.25 gram because this is 50% EC. So active in, I will explain only one so that the same thing applies for all. Temifos 50% EC means 2.5 ml. 2.5 ml will have only half of that will be active ingredient. And 100% means 100 gram in 100 ml. 1% solution means 1 gram in 100 ml. So 50% means 50 gram in 100 ml. So 2.5 ml means we are taking actually 1.25 gram active ingredient in that. So 1.25 gram active ingredient we are putting into 10 liters of water. Now what is the percent concentration? If you work it out that in 10 liters, so this percentage concentration becomes 0.0125. And what is the dose per square meter will come? Actually 0.0025 gram. If you say from this, it is actually 2.5 milligram per square meter. Whatever you are doing 20 cc, you are putting in that, so it will come like that. This way, all the larvicides, we have given a chart for this calculation. This will be immediately, it will be helpful for understanding the larvicidal application. Now come to the last point of space spraying, then we will go for the different settings for the formulation quickly. Space spraying is basically, it's an aerosol, which is liquid insecticide is blown. I have already explained, and the particle size is actually ranging between 1 to 30 micromolar. So, and this is VMD, volume median diameter. So this is basically, if you there is a bubble, you take line here. So this diameter across the volume total. So this is actually the diameter, that is what is taken, the micrometer. So this is what is VMD, we will be referring again and again. ULV applicators are having little slightly bigger than those of the thick fogs. This is thermal fogging. The basic concept of space spraying is, if the droplet size are bigger, it will not carry well through the air and it will drop down, it will not reach to the insect, it may not. If it is too small, it will just flow off, just like a water flowing. So it will not stick. But if it is correct size droplets are used, it will go and put on this. And that is how they are choked or they are killed. That is what the insect is being killed. This is basic philosophy of the space spraying. Now, you do indoor space spraying, you use atomizers like things. But when you are doing, there are two common things. Fogging is also a space spraying. ULV is also a space spraying. But by and large, we use common terminology. Space spraying means indoor space spraying we refer, which is we normally use some kinds of pumps and atomizers so that within the house, inside the closed compartment we do. But fogging is, it is basically gives an appearance that there is a fog, there is a cloud. What cloud? So here in fogging, thermal fogging, there is a heated air is in the combustion chamber. Heated air is released, and it is released immediately on the closed temperature. The temperature goes around 700 degree, more than 500 degree temperature. And the moment it is ejected into the 20 degree or 30 degree or 25 degree temperature, atmospheric temperature, it suddenly condenses, and that is how the fog is created. That is what. And VMD of such condensed fog is less than 25 micrometer. That is 1 micrometer is 1,000 of millimicrometer. 1,000 times of millimeter is smaller than that size. You can just see the scale and then imagine. Cold fog is another thing where large volume of air is used as a low pressure transform liquid. Directly you are putting insecticide formulation. Definitely we mix certain adjuncts, not as a diesel or not as a kerosene oil, and they are converted into small droplets because of that force, and then they are dispersed into the atmosphere, and then VMD is somewhere less than 50 micrometer, because you see thermal fog is the lowest one, 25 micrometer, and then cold fog is slightly coarser than that. Thermal fog, initially it was developed for oil-based mixture. Why I am telling this line, emphasizing that nowadays aqua fog has also come. So thermal fogger, this is a thermal fog he is using, he is putting mass. The droplet size are somewhere between, and 80 to 90% of these droplets which are released, they are very small size. The range is from 0 to 40, but 80-90% of these droplet size are measuring that 25 micrometers, something like that. And this is highly visible. Here, the product which is oil-based mixture, usually glycol is used. ULV spraying, now see the fog difference. You see the fog difference, so much visible fog, and here you see the fog difference. You can see little bit, but many of the people suddenly they will not see that there is a dense cloud is coming. So ULV is a mixture of mineral oil or insecticide at higher concentration, because there you are mixing with the diesel. Here you are directly putting the insecticide in a small droplet size, slightly bigger than the thermal fogging. And cold fogging machines are using, it is little more costly, and they are running at 4-stroke engines, so they are little more costly because of horsepower of the engine 18, because the force has to be a little more. Pressure has to be low, but force has to be very high. Now you see, this will give you a correct picture of this. The fine aerosol, the finest one, the smallest one is for the 25 less than 25 micrometer VMD. This is thermal fog. Slightly bigger, it is 25 to 50. It is a cold fog. It is little more coarser. It is basically for larval spraying. When we are doing that swath. Then furthermore coarse spraying. This is for IRS, indoor residual spray. And then more than this bigger sizes, they are basically for the agricultural purposes. So please make it a point that this is the scenario, it goes like that. Now how to calculate the sprayable area and requirement of the fogging? Surface area, if you take length by height and into 2, suppose the surface area and then width by height into 2 portions. Suppose you are going for indoor space spray. So if suppose there is a 4 meter length and 3 meter width and 2.5 meter height. So 4 into 2.5, that is 1 wall, and then 2 walls. So this becomes 20 square meter. Then if 3 meter width, the another wall, and 2.5 meter height will remain same for all. So it is basically 15 square meter. And then there is a ceiling. So length and width. So 4 into 3. So this becomes 12 square meter. Altogether it becomes 47 square meter. We are doing a space spray. We have to work it out in a cubic meter. So cubic meter, how much 47 square meter will be able to engulf the total volume of that particular area. So that there is another area, and that's a length, height and width. So length, height and width if you cover, and then usually 2/3 of the surface area. So 2/3 of the surface area, if you see 47 into 2 by 3. 2 by 3 of 47 comes around 31.3. And if you work out by length, height and width, it comes 4 into 2.5 into 3. It also comes around 30 cubic meter. So 30 cubic meter, it is also coming around 31 cubic meter. So it is almost same approximately. So it means if 4 by 3 by 2.5, you require 30 cubic meter. This is one. This is again the similar chart for Indian programs we have given, that we are using pyrethrum extract 2%, siphonothrene, that is synthetic pyrethroid 5% EC, for indoor, but for outdoor, we are using Malathion technical, and then cyphenothrin. How we are using, what are the doses recommended, and these doses are recommended by the research organization under Indian Council of Medical Research, Department of Health Research, Government of India. They have done 3 years trial and they have come out with their own dose, finalized dose with the discharge rate, with the kind of pump specified, everything. So this is all documentary evidence based ones. What you should do for the fogging, spraying, I have already told that you have to fill the tank, you have to mix the petrol oil mixture, must be correct and mixed. Then wear tear also, ear protector should be there. Check for leakage, otherwise there will be. Then check for all gases and control working. Do not touch the engine. No, nowadays though it is coming, little heat protection system has come because it will be 700-degree temperature. And when you are closing, you should see that drain remaining insecticide in a tank. You empty it, put the nozzle head in bucket with insecticide tank being high, and then open insecticide flow valve. Insecticide will be dripping out, but partially unscrew the nozzles. Amount of insecticide in bucket should be measured so that you work out for the daily consumption. Remove all the things, blow out orifice. You have to clean it when it gets clean. And kerosene also, everything should be washed properly and then kept it. If there is no regular fogging going on, that time you should completely clean, dry, and then keep it very safe. Remove the battery, that is very, very important out of this. Now, what are the timing and how to work it out per day? What will be the output for the fogging? Vehicle speed, suppose 8 kilometers per hour, which is recommended, that is 8,000 meters per hour. Swath width is usually 100 meters. That's a big swath which is coming for the either ULV or this. So 8,000 meter into 100 meter swath, if you work it out, that it covers around 800,000 meter, 8,000 meter into 100 meter swath, it becomes 800,000 meter square per hour in 1 hour. And that is meter, if you convert into the per minute, it becomes 60, you divide by 60 minutes, so 13,333 meter square, it will be covering per minute. Now 10,000 meter square is 1 hectare. So 1 hectare you are covering. So 800,000 meter square is covering, and if you divide by 10,000, 1 hectare, it will require 80 hectare per hour. So in 1 hour, this machine with this speed, with this discharge rate, with this swath, it will be able to cover 80 hectare in 1 hour. Time spent for fogging is usually 4 hours per day, not 8 hours or 6 hours or 10 hours. So if 80 hectares in 1 hour is covering, for 4 hours, it will be covering 320 hectares per day. That is what the questions are asked, that one machine will cover how much area in 1 day. So this is the answer for that. These are all usual average coverage which has been listed in different documents, that if you are using backpack, ULB mist blower, you will be able to covering 5 to 30 hectare. Vehicle mounted thermal fogger, you will be able to cover 850. You will be covering vehicle mounted cold, you will be covering around 150 to 225. And then aircraft and other things, you just forget about that nowadays. Now, when you are coming for the putting everything inside the draft of this knowledge, you have worked out the tools, requirement, need assessment. You have also to put some point for the guidelines development, amendment and advisory, advisories, then SOPs, whatever you will make, everything will be requiring finance. So when everything will be requiring finance, you have to put all these things. And there are some norms you have to fix up. I have just tentatively given, say, for example, development of new guidelines, manuals, or SOP. Suppose the estimated cost is 10,000 rupees USD per document. Maybe your requirement, if you require 10,000 copy or 20,000 copies, the cost may come down. It is just tentative one example I have given. And this guideline development include cost of consultant you are hiring, meetings you are doing, brainstorming session, workshop for evidence-based policy formulation, collecting the information, traveling here and there. So that will micro detailing has to be done, and the total will come tentatively this. For update or review of existing documents, it will be half $5,000. For printing of these, $5 per copy. So you have to work it out like that. Task force meeting for malaria elimination. If you are working out for per meeting, you will have to keep some money, 1,000 to $2,000. Then you have to work it out in different different activities, all those things for 5 years, 1, 2, 3, 4, and 5. And then you have to work it out. So resilient system of health management, GIS training and mapping, you have to keep some amount. You cannot keep for every year, so you will keep training and other things the first year, then you have to give gap of second year, then you do third year. By the time some new people will come, so you will again train them. Same thing for training, you have to give some amount, and this will come from the micro detailing of each Excel sheet chart. So like as enumeration of LLIN, how much you require, how much money you want for review, how much you want for training, for a spraying program, how much you want. So vector control operation, focal spraying. I mean, these are so many quality assurance, all those things, insecticide, quality assurance, checking, sending, bringing the sample, sending it to them, getting the reports, paying their fees. Then for the training purposes, I just gave one example that you have got this different level. The district malaria officer or state program officer, refresher training, 12 days or 3 days, the medical officer training, district vector-borne disease consultant, staff, lab technicians, informal private practitioners, and training of entomologists. So batch-wise, you have to put the cost, the detailed picture, and then finally, when you put the unit cost, you put, and then bring it club together that how much you require at the national level, how much you require at the state level, how much you require at the district level, how much you require at the CSC, PSC level, for which activity. Then only you will be able to cover this whole document, and then you club again by activity wise, total intervention cost, total program cost, governance and others issue, and then finally total cost, which may be initially it may be increasing, then automatically it will be sustained for some times. Now there should be a risk management. Suppose you are planning for 3,650 US dollar, million US dollar, or 3,650 US dollar. So if you are not getting those money in your draft document, there should be a proper column where if you don't get this, you have a second plan option. And if you don't get second plan, this is the risk involved. So the risk should be highlighted, not threatening, but there should be some percentage of threatening, so that they must understand that if we don't allow them to give this amount, or this amount is not allocated finally from the finance ministry through the health ministry to this program, we are not going to meet this target within this stipulated time. This is what I just wanted to say. From my side, thank you. Over to you. I have tried to finish slides little early because it was a little more complex subject. So I wanted to give more time for the discussions. Leo, over to you.
Yes, wonderful presentation as usual, Dr. Pradeep, touching on extremely important aspects, very relevant for practical field entomologists, for managers, for everybody involved in the hands-on malaria control, vector control aspects. Important to understand how to think about acquisition of insecticide, how to calculate the amounts that you need to purchase, spray coverage calculations, how many people you need to employ, all that kind of stuff, which will also determine how much transport you need and the finances involved. And it relates to, it's using different insecticides, also for larval control, for fogging, etc. So very, very practical, even although people may not remember it, they have a sense of the process you followed. They can go back to the recorded content and go through it again to understand better. Every time you watch it again, something else, the penny drops a bit more. So we need to re-look at the recorded material. Thank you so much for that. So there are a number of questions, Dr. Pradeep. Are we going to follow the usual way? You just take it from the top.
Yes, I'm going. I'm reading one by one, and then I'll try to answer.
Okay, thank you.
Not much. Yesterday there were more number of questions, but I think today's lecture is good enough so that most of the people either they have understood clearly or they have not understood. It is a complex subject. Both way it is possible. But anyway, I'll come back one by one. The first is, what are the most effective vector control strategy to prevent malaria? I have given you a documentary evidence based. You have to select. We have given you the tools. You have to assess that in your different situation, how best and which tool will be possible. For example, if a high burden malaria situation is prevailing, you have to attack it. You have to bring down the. So what you have to do? You have to IRS also you can do. You have to club with the long-lasting insecticidal nets. You have to work it out larval source reduction. If it is fixed and few and findable, you have to do all kind of social mobilization. You have to use all the social activities which are required to contain, bring the community, bring the stakeholders, bring the NGOs, bring the partners to support you. Different what you call it in organizations. So these are all the methods. Basic policy is that one single method or one single guidelines will not be able to give the answer for given situation, because malaria is a local and focal disease. Today you have got 20 cases, tomorrow you may have 22, or tomorrow you may have 15 or 10. So you have to go on narrowing down the area, and then slowly you have to withdraw your attack measures. But to sustain, you have to be very, very watchful. Source reduction and receptivity monitoring and vulnerability monitoring will be the long-term process. But initially, yes, you have to use all kinds of tools which are very effective in your area.
Dr. Pradeep, can I deal with the second one? Is there any possibility to arrange a webinar on
Yes, that is for you.
Yeah, yeah. So very interesting and a good timing that you ask this.
We are all ready as a resource, but arrangement is yours.
So on the 20th of September, 2 weeks' time, we'll be holding a Upman Tech Talk webinar on vector control in complex situations. And 2 of the 3 talks will deal with cross-border issues. There's one speaker from WHO and another speaker from Thailand. And the Thailand person will speak about the cross-border situation between Thailand and Myanmar. Our very own Dr. Pradeep Kumar Srivastava is also part of that webinar. And Dr. Pradeep is going to talk about, India is a huge country, and it's such a big mosaic of various different transmission intensities and very different situations. And how does one deal with vector control in that complex mixture of circumstances? So I would advise and urge everyone to try and listen in to that 3-talk webinar on the 20th of September, 2 of which will deal with cross-border malaria. Thank you, Dr. Pradeep.
That's right. Thank you for this information. And yes, we all are there. I know yesterday we have seen that flyer. Thank you very much, Leo. Now the second one is, what is good approach to engage communities to conduct community-based mosquito surveillance? Engage community. Why do you want only for community-based mosquito surveillance? Community-based mosquito surveillance is only you can employ them to see the breeding. They cannot become entomologists. As in the first day slides and second day slides, I have been telling, entomologist has got a very, very specific job. So mosquito, community-based mosquito surveillance, if you want to deploy or start, you can only involve community to look their water, peri-domestic or domestic breeding sites, and look here for their breeding. They may be anophelines, they may be colicines, they may be Aedes, they may be Mansonia, they may be any kind of this breeding, but they must be able to. So you have to give the training, and there has been lot of these kind of involvement, not only for community-based mosquito surveillance, but community-based surveillance and vector control. It has helped. There is a full document on Brugia transmitted Brugia lymphatic filariasis, Brugian filariasis, that has been given Brugia malai in one of the pocket of South India. That community-based participation has actually removed that whole pocket from the Brugian filariasis. That is one example. The another example is the entire National Institute of Malaria Research Center, which has got now 7 or 8 or 9 centers across the country. Those centers were established with an integrated disease vector control program, IDVC, integrated disease vector control. And it was started as a science and technology project. Later on, it was renamed as integrated disease vector control project. And their whole community involvement, holistic approach, see the receptivity of the area. If there is an water logging, water accumulated, which is very congenial for breeding of the mosquitoes, come back. With the community participation, we have leveled, we have filled those areas, we have made that area into playground. There are many, many examples, and there is a full booklet published under Indian Council of Medical Research. So these are the examples where you can have the community-based. The latest one, which we, during our time when we instigated, that we have got the last village level under National Health Mission in India, community volunteers, which is known as ASHA, lady workers, that is community volunteers, accredited social health activists. They are involved with very small incentives that they are given 1,000 population in village, one ASHA worker. And the ASHA worker will go and see the breeding also checking. They will not be able to differentiate. But if there is a breeding, they will try to destroy that source, or will take the help of the residents and try to destroy. And they will give per house or some incentive is given, or per day some incentive is given. So they are actually incentivized to look after, and they are from the same village. So these are all the 3 modalities I told you about, the community-based vector surveillance and vector control. Then there is another one is I'll share. This Jenny. I will share those 2 papers I have just listed out. Jenny, your number I don't have. I have got only one number, email ID from Ulan. I got from yesterday. I got only one email ID. So, but my email ID is with everyone. pkmalaria@yahoo.co.in. So that is simple to remember. You can send it. I will send both the papers. I will be difficult for me to copy it right now. 1 second. Okay. So then can be used expired accessibility test paper? No. Not at all. You should not. You should use only for the practice purposes. And then how can we involve the public and intersectoral partners in the IC activities at a better way, since they forget the things to follow after some time? In Delhi especially. No. It is not that. It is a regular, like medical education. You have heard about continued medical education program, CME. IC is not a magic bullet. It's a complete whole year activity. You have seen one chart where I have shown which activity, when and how and where. So IC, now it is called as BCC, social behavior. It is very difficult to train the highly educated people because they will use their own intelligentsia. But this is your baby. You have to tell that, and that is where the penalty clause comes into. That helps you. If your penalty clause is very strong, they will have to bear. If somebody is driving rash without helmet, they know that if police catches them, they will be penalized. So that kind of knowledge should be there. This is an important question, but there is no magic bullet for them that one capsule you give them and they will be your pets. You have to bring them because they are all independent people. You have to continuously put your ideas into their brain. That is what is brainstorming IEC sessions. Then whether the 2.5 ml Temifos is effective in any depth of water collection. No. 2.5 ml, there is, if you see, you are from India or if you are from some other place, I do not know. 2.5 ml workout has been done. It is for the depth of 30 to 50 centimeter only. If the depth is more and it crosses beyond 50 centimeter or 40 centimeter, you have to double the dose. But please make it a point that Temifos is not recommended for polluted water. It is primarily recommended for anopheles, and because Aedes also breeds in fresh water, stored water, it is active against both Stephensii, and it is not very effective in drains, though we have given the guidelines, but there are certain cemented drains and nalas in peri-domestic area. You can use where the water level is hardly 2 centimeter, 3 centimeter, or 4 centimeter. It is not beyond this. It doesn't go like this. So please make it a point that many of the area where Temifos is actually misutilized for Culex control or for Mansonia control, it may not be very effective. You keep this safest insecticide, and there are other products, biolarvicides, there are other products, insect growth regulators, you can use all those things. Then how much effect of fogging is remaining in the air? I don't understand what is the question. How much effect of fogging? Fogging is only recommended for outbreak containment. It is suspended in the air for 1 minute to 5 minutes maximum, and that period, the droplets which are suspended in the air, it kills the infective mosquitoes. They are prevalent during outbreak time. Their number is more and more and more, very high potential. So the purpose is to kill the infective mosquitoes so that the transmission is not there. Let the young generation come and be mature. By the time we will get some time to take care of them. Can we recommend fogging in malaria outbreak? If yes, please elaborate. See, WHO guidelines has very categorically said that fogging is not recommended for malaria outbreak. For global recommendation, I will not say beyond WHO because they are the technical guide and they have recommended that in malaria. But in India, any outbreak happens, malaria or dengue or JE, there is a fogging. And we have not withdrawn. We have not withdrawn our policy for fogging for malaria outbreaks or dengue outbreaks. Many of the places people are doing it as a routine. That we do object, but that depends on the municipal corporations and other things, the implementers. But outbreak containment, WHO has very categorically said that fogging is not recommended in malaria outbreak. Fogging is not recommended for malaria elimination. That is what their sentence is. Then this is whether ready-made aerosol can available in market or efficient for conducting. We have already given, you are from the Kerala, Sajju 3rd, I believe. We have already issued the guidelines and you please follow the Government of India guidelines. Whatever we have said for other countries also, that you should follow your own country's regulation. You can't just go and buy from the market for whatever is available. Because market, there are many things which are available, which has not been recommended under the program. So please see, there are 3 things I have showed you the chart: pyrethrum extract, malathion technical, cyphenothrin. There are now three items options are available for you. Then whether the neem cake can be used for the control of larval breeding. This is still under trial. Neem, there are 14 types of formulations. Central Insecticide Board, which is the regulatory body in India, they are connecting, they are seeing, they are recommending. Many products which are recommended so far has been recommended only for the agriculture purposes. There are some formulations which are quickly coming. We have heard that some of the government undertaking they have taken up. This is under UNIDO project. This is in the last phase. But unless it is registered, and then after registration, some manufacturer approaches the program through their institutional mechanism, they takes it forward and recommend it. and includes under the program, the guidelines cannot be issued that how much quantity, what dose, what formulation. You have seen the presentation. If the guidelines are given by the program, you can explain it in a very better manner for others to understand. If the program has not taken, you see the level of the things which are available in the market, so much details are not given on that. So please be cautious of that. I can just warn you. Another one is that is it done by kerosene and pyrethrum extract using flit pump? Indoor space spray ISS done by kerosene and pyrethrum extract using flit pump creators AL. That is what is in indoor space spray. I told you that you are releasing some aerosols. Whether you use finite pump, you use Ganesh pump, you use atomizer, you sometimes you use the hand compression, hand operated small fogging machines also, but they are all released in the space. People are positive whether we can use the same formulation in mist blower for doing ISS. Mist blower you can do if it works with the same kinds of this thing. If it works, that pump works, they have got the pressure gas and whatever amount you want to release, the amount should not go more. Basically, all the atomizers are mist blowers. Basic technology is same. That the rotator which moves and it starts giving the mist. Muhammad Asi, in general, for application of larvicide, we consider 1.5 meter distance from the border of the water body, considering that most of the mosquito larvae do not get much away from the border. Please comment. This I don't understand.
So if you're standing at the edge of a lake or dam or river or stream or pond, he's suggesting, I think, you only need to spray the very edge where the water joins the land, about 1.5 meters along the edge, because that's where most of the
That's right. That's right. Because deep side, center side, they will not go for egg laying. That's right. Very right. Explain indoor fogging by using atomizer, etc. But in general, in our situation, handheld fogging machine, that is also done. There's no issue. There's no issue for that. What is your point about doing indoor spray by this method? Yes, it is allowed. It is done. Most of the time, because atomizers and fogging, the smaller ones, they don't use in the program mode, because you fill up one tank 5 liters and then you go on doing a small amount of this fogging. Community-based surveillance. I have also to Google, you have also to Google, but I think I have 1 or 2 documents, not on community-based surveillance, but community-based vector control. So I'll try to share with Appman, I'll share and then it can be shared. Or if you want, you can send me the email, I will share with you. Thanks for the details presentation. Due to unavailability of internet connection got late. Please recommend to me my area high transmission. What is this? Samina Baloch, respected sir, thanks. So larvicide which has no hazardous effect, please recommend. All the larvicides which are recommended under WHO with a range and then taken by the program with their own internal trials, they are all safe. Temifos is one of the safest which can be used in potable waters. Biolarvicide also, the quantity which is recommended with the regulatory body is again safe. The insect growth regulator also which is recommended, this is also safe. So they are all safer insecticide because the dose which are calculated and recommended. See, when there is a trial, before inclusion in the program, the effect on target and non-target insects are seen. This is very, very important. So that is why there is no hazards. All those things, whatever I have told, the Temifos, biolarvicide, then insect growth regulators too, they are all safe. Pyrethrum. Please elaborate a little bit about the climatic change impacting VVDs. I have explained yesterday that climate warming situation brings down the area which were cooler earlier. They are now reporting breeding and presence and abundance of the vector mosquitoes, and then there are likely that indigenous transmission may be established. Jenny, I did not hear talk about aqua tannin. Aqua tannin may be some name for the brand name, of a product for monomolecular surface film. See, any oil, mosquito larvicidal oil, MLO, I showed you in the chart. Mosquito larvicidal oil, which is a byproduct of the petroleum refining process. That is recommended long back. It is used. It has no toxic effect, but only thing if it creates only film, which is basically respiratory tract blockage, and that is what is any other oil which is viscous but lighter. It will spread fast. It will make a monomolecular layer. But what is its feasibility studies? What is its registration? What insecticidal property or without insecticide property? What is its commercial aspect? All those things have to be seen and then cleared through regulatory bodies only has to be taken. So aqua tannin may be one of that kind of laser. Now I heard that MLO, mosquito larvicidal oil also Indian oil company, which was originally Shell company, Shell International, they were manufacturing. They are coming with some pale color mosquito larvicidal oil because this was looking like a burnt diesel oil. So now they are coming, but they have to come through the proper channel and through the institutional system. You have to cross for all the countries. Some fogging machine dealers claim dual purposes. Machines, thermal fog and cold fog, is it okay or separate machines? You have to see the specification for them. What is your requirement for thermal fog? Because cold fog, they don't require any burning chamber or combustion chamber. Cold fog has to be propulsive forces. Yes, the machine which is used for the thermal foggers, if you switch off that heating element, you can use it, but you have to see the discharge rate and flow rate and pressure created. The second one is many of the thermal foggers, they are utilized for aqua fog also, because initially I told you in the first sentence of my slide that initially all the thermal fogging instruments were made for oil based compound, but now they are claiming that it is the same machines can be used for aqua fog also, because there also some heating arrangement is done. But the only thing aqua fog, there is a difference that when the water molecule is small, one small oil things has to be added so that creates a circle around the water molecule so that it doesn't evaporate immediately and burst out the moment it comes in the environment. So it has to remain intact for some time before it falls down. That is what is 1 minute to 5 minutes total time. How much, which is the best compound which remains suspended. Water molecules falls little rapidly than compared to the water oil-based molecules, because suspensibility in air is high for the oil-based than the aqua fog. But aqua fog has got its own advantage. It has got a lot of resource meeting. It is cost effective. Any other thing? If I have missed anybody, they can raise their hand if I have missed anybody.
So mine was the last question, sir. That what is the current status of effectivity of the plant-based larvicides? Because a lot of research is going on in finding the plant-based larvicides. So, sir, what is your experience?
Good question. Plant-based larvicides. Plant-based larvicides are, many researches are going on, you are right. But none of them has approached to the program through institutional system. There is a system of introduction of any compound in the program. If they have insecticidal property, I mean, their mode of action is very, very important. The basic problem with the plant products is that you have got lot of alkaloids, and in that, which one is actually acting? If they have got insecticidal property, they have to go through insecticide board of the country. And once they get insecticidal application cleared with their forms and formats, I mean, some commercialized, suddenly some research output, some research-based organization, if there is no commercialization of the product, because if you are recommending something in the program, it should be available for logistics purposes. So that is how some manufacturers have to take up. And then when manufacturers take up, we made one guidance document for the manufacturers for so many items. In that, manufacturers have to come take the technology and come forward, and they will see their business plan. They will see their business in that area. Then only they will come. Program, initially, it will not say, okay, we have developed this, because program does not develop. It's the research people, they develop or they come to the technology and then they sell it. That is why there are many items which are coming. The commercialization aspect has to be seen by the commercial people. Thank you.
Pradeep, at the bottom of the list, there's a question about replenishment cycles of LLINs, which I think are standardized at 3-year cycles of
Yes.
replenishment, but there's also continuous distribution via the vaccine programs and so on. So I'm not sure if you can see the question. So my question is about how many replenishment cycles of LLIN every 3 years efficacy. So I think what he may be getting at, or her, is do the nets actually last the full 3-year cycle? And that is a webinar in itself, I think, but maybe you can give a quick response.
Where is that question? I'm just searching that.
Right at the bottom. So I think it's got to do with bed nets are distributed mass distribution every 3 years. Is that good practice? Do the nets actually last for 3 years? So we know that in many countries, the nets actually only last about 18 months and they get discarded because of holes and so on. And some countries are also having problems with the bioefficacy of the net not being up to what is supposed to be. Any comments about, is 3 years an appropriate cycle of replenishment, Pradeep?
Anyway, I could not see the question, but what I have heard from you, Leo, usually when it started with BedNet program in early 90s, it started with simple bed nets and cotton bed nets and thread, multiple thread, single thread. Then it came the polyester net, then came the nylon nets, but fire hazard, this hazard, that hazard. Finally, it was given that, okay, polyester bed nets or this cotton bed nets will be very easy to treat them, multi-filament, so they will retain. But then when it came to LLIN, the insecticide is impregnated at the time of manufacturing itself, when they are weaving the thorns, and it is given at a very high dose of insecticide is placed inside, and there is a releasing agent. That's what paper I was discussing, I'll be sharing. So they will release slowly and the amount will come on the top, slowly. So this, whatever adjunct they have used, that one is that denier strength of the mosquito nets, wear and tear, and the release of this process, how long it brings out, and that amount of the insecticide is being released, so released. All those things put together, the effectiveness of this bed nets, it is 3 years only. And that is why actually it was between 3 to 5 years. But when it is taken in a program feasibility mode, some are torn, some are thrown, some are washed, because 20 washes in, only it will retain. So 20 washes means if 3 years, 36 months. 36 months, even if for 2 or 3 months you have given gap, or 4 months or 5 months you have given gap in 1 year. So if you have given 15 months gap, so it becomes 20 washes. By the end of 3rd year, you will be washing usually more than 20 washes. So the insecticide will not be there. It will be a plain bed net. And in 3 years, wear and tear, usually normal bed net size, it continues. If you are daily utilizing the bed net, it goes, turns off after 2 years or 3 years. But here in LLIN, the denier strength is 100 denier. Above 40 denier is mandatory. So the wear and tear also, it goes for 3 years. That is why in the program mode, WHO, seeing across the world, we have fixed up that it is the shelf life should be 3 years. Shelf life does not mean that after 3 years, immediately it will go waste. It cannot be, because some of the people, they ask, if the insecticides aren't there and we have got some compound to re-impregnate, can we use it? If the mosquito bed net is quite intact, yes, you can do it. There's no problem, because this will become plain bed nets now. That was the logic. I hope I have answered.
Yes, no, you have. Thank you very much. All right. So here's a question from Mohammed Asif Mahmood. In your country vector control program, are you strictly bound to use WHO pre-qualified products for vector control, or can you use any other products as well? I think that's
I can cite example of my country only. No, because WHO recommendation, if you see, pre-qualified product, WHO says that you should, because pre-qualification, or earlier it was Hooper's specification, they were doing multi-country trials. But if your country is self-sufficient and you have to study, if something has been studied in African country, if something has been studied in Brazil, something has been studied in Australia, something has been studied in Indonesia, how can it be relevant? One side you are technically saying that malaria is a local and focal disease. In our country itself, what is relevant in south of India is not relevant in northeast of India. What is relevant in core of India, central core of India, that may not be relevant for Indo-Himalayan range bordering Nepal area or bordering Bhutan area. So there are a lot of variation in Indian scenario. And we have got enough capacity of scientists and research organizations within our own system. So we select those compounds, but we do trial. And in doing that trial, we have set a common protocol. That is all on the website of all the 3 organizations, program, as well as National Center for Disease Control, as well as on Indian Council of Medical Research. In that, we very clearly say, if some product is WHO pre-qualified, we will skip the stage 1 trial. Because stage 1 will give you a range of dose and its own basic characters of the product. So what we will do, we will start from 2nd phase trial and 3rd phase trial. That is a small scale field study and then large scale multi-centric field study. When we do multi-centric field study, the same dose which has been recommended, we will see that how 2 doses or 3 doses are effective. And then we will see what is effective. We did same thing for larvicide, we did same thing for 5 synthetic pyrethroid for IRS, we did same thing for LLINs. We did try. LLIN, it was initially brought in because it was under the donor-driven support under initially World Bank project and then Global Fund supported project. So whatever they supplied, and that is what is happening for many smaller countries, that if it is donor-driven program, in their donor-driven agreement, if they are supposed to supply LLIN, they will procure and they will supply. So whatever the country is getting, it is okay. But when it comes on the local purchase, it has to go through the domestic systems.
Well, I think our audience will agree that over the 4 days, you've given us a very, very detailed, comprehensive insight into all the different elements that go into effective malaria vector surveillance and control. All the elements that should be considered and incorporated into your strategic plan, thinking, structuring a document that will provide the guidelines and policy for implementing an effective surveillance and control program. So we're all the better for having gone through this. We thank you for the thoroughness.
Leo, 1 minute to interrupt. You can now tell everybody to open their video and you can tell Ulan to take a snap for that.
There we go. That's a good idea. Yeah, I think everybody, if you can turn your video on, and then Wulan can take a photo for us. Broad smile, everyone. And while you're doing that,
Please
I'm going to
continue.
continue talking. Just to thank you, Dr. Pradeep, again, for an excellent 4-day series of lectures. Also to our support team, Dr. Pon in Singapore, Wulan and Popo here in Bangkok, and of course our audience. Very, very grateful for your patience, your persistence, your interesting questions. It's the audience that always make it worthwhile, and we're grateful to everyone. So Wulan, I hope you've taken a nice photo, a group photo.
Yes.
And yeah, thank you, Wulan. So let's give 3 people the opportunity. First 3 hands up if you want to give your impression. Did you like the course? Did you find it worthwhile? 3 people. There's Neha Agarwal. I see your hand up. Neha, do you want to say anything?
Yeah.
Yes, sir. The whole session for these 4 days, I must thank Dr. Srivastava for making such informative slides, sir. Each and every slide was full of knowledge. I would go back again. I've taken personal screenshots also, and especially for vector management, right from especially the cases, the examples which he was giving, which was real-time experience of his, which we will not get from any book or anywhere else. So I must applaud sir for this, for sharing his 40 years of experience of his life with us in this 4 days course. Each and every question, the way he was answering to all of us with lot of patience. And I also thank Leo sir to you for coordinating this course, because each and every person is being heard and answered in this course. So I'm so thankful to the whole team. I'm thankful to sir and all the participants also for making this a successful event, sir. Thank you.
Thank you for that, Neha. Wonderful words, and I fully agree with you. There's another person, we've lost the pictures and so on, but there was another person that raised hand. So please make yourself, turn on the audio and please go ahead.
Oh, Dr. Somalkar sir is also there. Sir, namaskar.
Please go ahead. Wulan, did you want to say something about the feedback evaluation?
Dr. Srivastava encouraged everyone strength feedback evaluation.
Wulan can't hear you, unfortunately.
Hear my
Slightly better.
voice.
Try again, Wulan.
So I just want to
Wulan, you can come over here.
encourage participants here in the training course to complete the feedback evaluation form by scanning the QR code here, or just click the link that I shared with you in the chat box. That's all. Thank you.
Thank you, Wulan. Was there a member of the audience, perhaps, that wanted to say something? Please just make yourself live and go ahead.
Information, sir, we got it from this presentation. Thank you very much, sir. From Andaman, I'm Kalyamurthy.
Oh, thank you. Thank you.
Thank you. Okay, sir. Thank you.
All right. So I can't see if anybody else has raised their hand, unfortunately. The screen is, oh, there's Abdul.
Yes, Assalamu alaikum and namaste. I'm Abdul Hamid from Sindh, Pakistan, and I'm thankful Dr. Pradeep Srivastava and Leo Bragg sir. I have learned a lot from your session, and the session has improved my learnings in especially vector surveillance and planning and other developments. And so nice of you, sir. And thank you so much, sir.
All right, just one more person, please. Go ahead.
Sir.
I am Asif from Pakistan, Lahore, and I am very much thankful to Dr. Padri, which is very informative and solved many issues, technical issues related to the implementation of especially insecticides, IRS, and others. I am highly thankful to Dr. Pradeep and also Dr. Liu and Appman team. This is very informative, and I recommend you that this series of such seminars should be continued and technical knowledge should be shared to enhance the local level at all countries. Thank you very much again.
Thank you, Mohammed. Thank you so much. Yeah. Well, Wulan,
Dr. Liu, Dr. Liu, this is Kalpana.
Oh my God.
okay. Hi, Kalpana.
Good
Welcome.
afternoon.
Yeah, I've been
Yeah, good
watching your
afternoon.
name.
Today is a holiday. I was working and listening to him.
Good for you.
It is
Good
always
for
a
you.
pleasure
Thank
to
you.
listen to him. Yeah.
Yeah. No,
So
thank you
somebody
for
was
joining.
asking about the Indian IVM guideline. So you can give the website link on the chat box so that people, if they want, they can download it from there.
Wonderful. Wonderful. Thank you for that. The website link if Dr. Pradeep or someone can
Shall I give now? Shall I give now?
I'd be grateful. We'd be very grateful. Thank you for that. In the chat box, maybe. Yeah.
Okay. Okay. I'll post it now.
Yeah. Dr. Kalpana, thank you so much for coming in. We appreciate, and we all know you're a very busy person, so we appreciate you taking time off to listen into this series. Wulan, I think if you want to put up that slide you had earlier on so people can take a screenshot of that if they want. If somebody missed that, there we go. Yeah. So we'd be very grateful, if our participants, a good proportion of you, if you wouldn't mind giving us some feedback. It's a short survey, won't take you very long, couple of minutes, even if that. So just to give us an idea of where we can improve, what did we do okay, really helps us to improve for our next course. So just a couple of minutes of your time. We'd be very grateful for your feedback on this survey. But again, Dr. Pradeep, always a pleasure to have you as part of you're a regular contributor to our training sessions in many different ways, including webinars, etc. So we appreciate you sharing your lifetime's worth of experience, the knowledge you gained, and doing it in a very a wonderful, warm and friendly and effective way. Thank you for that. And thank you to our audience. Thank you to our support.
In fact, Leo, I am thankful for you to give me opportunity regularly. Thank you so much.
My pleasure. All right, everyone. Have a wonderful
Leo,
day.
I have provided the link. Bye.
Sorry?
Leo, I have already given that link of the website.
I'm going to keep my eye on the chat box. Thank you so much, Dr. Kalpana.
Bye, everybody. Bye. Thank you.
Thank you, sir. Thank you.
Bye now.
Thank you, sir.
Thank you so much.